Hello, my name is Ashok Reddy. I'm with Peachtree Orthopedics, and I hope you're doing well. I'm like the rest of you. I'm trying to isolate and quarantine during this difficult time, but I'm also trying to maintain some sanity and stay in shape and do some exercise at home. And I know a lot of you are probably interested in doing the same thing, trying to stay out of the gyms even if they're open, just because of concerns of the coronavirus. And so you may be working out at home, you may be doing exercise videos, you may be doing some free weights or yoga or CrossFit. So what we're going to talk about today are shoulder injuries, which are very common with weightlifting. So one of the things you can do to try to help prevent shoulder injuries prior to weightlifting or exercise is to do some simple stretching routines. So one of those is where you can gradually raise your arm up overhead over like a 5 to 10 second count. And by doing that, you're stretching out the latissimus, the triceps, and some of the structures in the back of the shoulder. Another one is to slowly reach across your body like you're reaching all the way across, and to feel that stretch and hold it for about 5 to 10 seconds. And that's also stretching the back part of the rotator cuff and the back part of the shoulder lining or the capsule of the joint. So both of these are very helpful to do prior to exercise. So when we talk about shoulder injuries that can occur during weightlifting, we talk about acute injuries and we talk about chronic injuries. So acute injuries are those that occur suddenly, like kind of a sharp pain or a sudden weakness, or you may feel a pop in your shoulder. You may see some bruising or swelling or like a deformity around the shoulder. Then you have the chronic injuries, which are more that occur over time, that occur because of maybe increased weight, or maybe there was fatigue, or maybe not enough rest in between sessions, things like that. Both types of injuries are treated similar in the beginning, and that will be a variation of the RICE, which is rest, ice, compression, and elevation. So for the shoulder, the first thing is rest. Rest from any type of activity that causes pain. Ice around the shoulder, 10 to 15 minutes every couple of hours. You can use either a topical or an oral anti-inflammatory medicine, like a Motrin, Advil, Aleve, things like that. And in some cases where there's a significant amount of pain, you could use a sling for a couple of days. But we really want to restrict that for any long-term sling usage, just to limit the risk of scar tissue or something like a frozen shoulder from occurring. In most situations, the injury is going to gradually improve, the symptoms are going to improve to the point where you can raise your arm, the pain is lessened, and then you can gradually get back to weightlifting or exercise type activities again. And sometimes that can occur over a 4 to 6 week period, but hopefully it's much sooner than that. In some cases where there's a significant amount of pain, trouble lifting your arm, trouble sleeping, things like that, that might warrant a formal orthopedic evaluation. And at Peachtree Orthopedics, we can do that as a virtual telemedicine visit, or we can do it as an in-person visit if you feel comfortable with that. That would also involve a more in-depth physical examination, x-rays, sometimes a prescription anti-inflammatory medicine or an injection, and in some cases we need to get an MRI. But fortunately, most of these injuries will resolve without any additional type of treatment. So hopefully that was helpful. Hope, again, all of you stay safe and healthy and injury-free. Thank you.